Hey there, fellow viewers. Welcome back to our channel, Toganta Health. Today, we have an incredibly important topic to discuss. This topic is called prediabetes. You might be surprised to know that millions of people around the world are living with prediabetes without even realizing it. But don't worry. We've got you covered with today's video on the top 13 signs and symptoms of prediabetes you definitely should not ignore. Before we dive in, if you haven't already, make sure to hit that subscribe button and ring the notification bell so you never miss our proactive, life-changing content. So why is prediabetes such a big deal? Well, prediabetes is a serious condition that often goes unnoticed. You can be prediabetic for as long as between 20 to 30 years before being diagnosed as diabetic. Approximately 90% of people living with prediabetes are unaware of this potentially silent killer. Prediabetes is a warning sign that your blood sugar levels are higher than normal, but not high enough to be diagnosed as diabetes, a chronic condition we know all too well. Identifying these signs early can make a significant difference in preventing diabetes. Yes, prediabetes is reversible if caught in time and appropriate lifestyle changes implemented. If prediabetes is not reversed in time, diabetes will result. This can lead to other medical conditions such as hypertension, kidney failure, heart disease, stroke, and even blindness secondary to untreated diabetic retinopathy. Early identification of prediabetes signs and symptoms are important. Stay till the end, as some of these signs and symptoms are critical and must be addressed as soon as possible. Number 13. Darkened skin patches or Acanthosis nigricans. Acanthosis nigricans skin patches occur when epidermal skin cells begin to grow rapidly. This abnormally rapid skin cell growth is most commonly triggered by high levels of insulin in the blood and is often linked to insulin resistance. Keep an eye out for dark patches on your skin or the folds of your skin, especially around the neck, armpits, and groin. Skin tags on the groin, armpits, neck, and even the eyelids can also be indicative of high blood sugar levels. Number 12. Numbness and tingling of the hands and feet. High blood glucose levels secondary to prediabetes may cause damage to nerve fibers, with the end result being nerve deterioration. Please note that diabetic neuropathy is also seen in type 2 diabetes. Number 11. Unexplained mood swings. The brain uses glucose as its main source of energy. Normal blood glucose levels also contribute to optimal mental well-being. When blood glucose levels are higher than normal, this is irritating to the brain. This results in poor concentration and unexplained anxiety, anger, and irritability. Stress increases blood sugar levels, making the problem worse. It is important to note that once blood sugar levels return to normal, these symptoms often resolve. Number 10. Increased thirst and urination. One of the earliest signs of prediabetes is feeling constantly thirsty and having to use the restroom more frequently. Your body is working hard to eliminate excess sugar through the urine. Do not attempt to resolve thirst with sugary drinks. This will only worsen your condition. Number 9. Weight gain. Insulin resistance makes you hungry. Constant hunger makes you eat more and more food. Increased food consumption combined with insulin resistance leads to increased blood glucose levels. Excess unused blood glucose is stored as fat. This is a dangerous chain reaction that can lead to obesity and its accompanying chronic diseases, namely a heart attack and stroke. Eating late at nights and poor sleep habits increase the risk of obesity, especially in persons with prediabetes. Research shows that even the smallest of weight loss can decrease blood sugar levels. So, start your weight loss journey today. This could save your life. Number 8. Unexplained weight loss. This is the opposite of number 9. You might be shedding pounds without trying. This happens as your body starts to break down muscle and fat for energy because it can't effectively use glucose. Think of this as the body now feeding on itself, or the body eating itself. This is seen when prediabetes goes untreated and is progressing towards diabetes. Number 7. Unexplained fatigue. Feeling tired even after a good night's sleep? Prediabetes can affect your energy levels as your body struggles to regulate glucose. Remember, a larger quantity of glucose sits in the bloodstream, and a smaller quantity of glucose gets to the cells because of insulin resistance seen in prediabetes. This results in poor or low glucose availability to serve as an energy source. Persons with prediabetes will feel exhausted even at rest. Number 6. Blurred vision. Diabetes can affect your eyes, and prediabetes is no exception. Increased blood sugar levels cause the eye lens to swell and bulge. This decreases the ability of the eye lens to focus on objects properly. Swelling of the eye lens and blurred vision usually resolves when blood sugar levels return to normal. Number 5. Frequent infections. Prediabetes weakens the immune system, making you more susceptible to infections. If you find yourself getting sick often, this could be a red flag. Number 4. Slow wound healing. Notice that cuts and bruises take longer to heal? High blood sugar causes the blood to be thick and sticky. Thick, sticky blood damages the inner lining of blood vessels over time. Also, thick blood does not flow smoothly. Thick blood and damaged blood vessels decrease adequate blood flow to the injured tissues. Impaired blood flow leads to decreased oxygen and nutrient supply to the injured tissue. This, in turn, hinders the body's ability to repair itself. Number 3. Tingling or numbness. Prediabetes can damage nerves, leading to sensations of tingling or numbness, especially in the hands and feet. Number 2. Increased hunger. Experiencing constant hunger, even after meals? Excess hunger results from glucose or sugar sitting in the blood and not getting to the cells because of insulin resistance. Simply put, the cells are deprived of glucose and are starving. Eating more food does not resolve hunger in the long term, but only increases the blood sugar levels. Seek treatment fast. Need a natural treatment method? Then check out our video on why fasting heals, the science of body repair, and intermittent fasting health benefits. Links can be found in the description below. And the number 1 sign of prediabetes is family history and risk factors. Your family history and certain risk factors, such as being overweight, inactive, or having a poor diet, significantly increase the likelihood of prediabetes. It's crucial to be aware of these factors and take preventive measures. There you have it, the top 13 signs and symptoms of prediabetes. If you or someone you know is experiencing these symptoms, it's essential to consult with a healthcare professional for proper diagnosis and guidance. Remember, knowledge is power, and catching prediabetes early can make a huge difference in your health journey. If you found this video informative, give it a thumbs up, share it with your friends and family. Don't forget to subscribe for more content that empowers you to take control of your health. Thanks for tuning in, and until next time, stay healthy and stay informed.